Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. I want to take a moment and reply to a comment left on my last video in regard to the good news about cancer survivorship. And it comes from, and I want to make sure I say this right, Denise underscore 1969. I really think it's a mix of traditional medicine and people seeking integrative care. And that's a really good comment. To be upfront, I support traditional medicine to treat cancer. I don't believe that it's possible to achieve remission without it. Now, that said, I also do believe in alternative, supplemental, and complementary. The catch is you have to have the oncologist included in making that decision. Your oncologist who has studied everything about your diagnosis with cancer, the makeup, the lab work, the scans, and everything else like that. They're the ones who will have the best plan. And the care that you want to use with integrative medicine is you want to make sure that it doesn't interfere, that it doesn't contradict, and that it doesn't delay, your treatments. Treating cancer is a time sensitive thing, and if you waste time, doing things that aren't necessarily good or won't benefit, you're allowing the cancer to progress. And if it gets too far, too fast, too much, there may not be any turning back. So, what is integrative medicine? Basically, it's a patient centered approach. You combine the chemotherapy, radiation therapy, surgery, whatever, with other treatments that focused on the mind, the body, the spirit, basically to lift yourself up and mentally make yourself stronger. Going through treatment is not an easy thing, so it does require some mental toughness with that. Um, Integrative medicine emphasizes lifestyle changes, preventions, things like that. There's a whole holistic outlook to it, um, evidence based. Your patient practitioner is it's important that you talk to your doctor if you want to integrate, hence the term integrative medicine. Okay, some of the therapies that get used, mind body. Okay, we're talking medication or meditation, yoga, tai chi, biofeedback, breath work. Obviously talking to a therapist, nutritional approaches, something I'm not really good at, but dietary changes and herbal supplements, aromatherapy. Those are things that you really need to be careful with that they don't contradict any of the medications that you're being given. Of course, physical therapies, acupuncture, massage therapy, physical therapy. Again, depending on the type of cancer that you're dealing with, you've got to be careful with massage therapy, especially. Okay, because massage, like for instance, if you have Hodgkin's lymphoma, okay, that's a cancer of the lymph nodes. You don't want to be massaging lymph nodes that are filled with Hodgkin cells and be pushing them all over the place and causing all kinds of problems. And of course, lifestyle modifications, sleep, stress management, and exercise. And one of the common questions that I constantly see people putting on social media, asking about exercising while they're going through treatments. And of course, any kind of exercise is good. But sometimes I think people are looking to go gung ho and continue the exercise regimen that they have while they're healthy. And the fact of the matter is, your body going through cancer treatment is really being traumatized and really is not up to the abuse, the physical stress of going through normal workouts. So if you are able to do walks, fine. If you're able to go for a bike ride, fine. If you're able to do some light lifting, fine. But if you're ending up really fatigued, really worn down, that's your body trying to tell you, hey, ease up a bit. Now, like I said, if as long as you consult and keep your doctor in the mix with everything that you want to do and they give your blessings, have at it. Whatever helps you achieve remission, and that's your goal. You don't want to do anything that's going to slow that process down or even stop it. So consult your doctor. If integrative medicine works for you, that's great. Until next time, this is Paul's Heart.